A 45 years old woman identified having the gastrointestinal stromal tumor, which is the GIST. What is the usual cell of origin of this lesion? That means in case of the GIST, which is the gastrointestinal stromal tumor, it is originated from the which of the cell. So it is the direct question regarding the GIST. That means from which cell GIST is derived. Here the options are the Brunner cells, interstitial cells of Kajal, primitive stem cell of the gut wall, fundic gland, and antral goblet polyp. Here we can see this is an GIST, which is the gastrointestinal stromal tumor, commonly arises from the stomach. Here we can see the excluded stomach with the gallbladder. And the gastrointestinal stromal tumor, it is not a common tumor in case of the gastrointestinal tract. In gastrointestinal tract, there is most commonly tumor is the adenocarcinoma, and the originated primarily from the interstitial pacemaker cell, which is known as the Kajal cell. So interstitial cell of the Kajal or pacemaker cell of the intestine, from there the gastrointestinal stromal cell derive. And the GIST usually affect the stomach, it is about 70%, then a small intestine 20%, colon and rectum 5%, and 95% of the solitary lesion, and most are sporadic. That means the predisposition for the genetic predisposition usually absent, and majority express the CD117. So CD117, it is expressed by the gastrointestinal stromal tumor or GIST, and there is mutation of the CKIT gene. Here we can see the interstitial cell of Kajal. They are present in a different layer of the gastrointestinal tract. Here we can see the submucosal interstitial cells of Kajal. Then here we can see this is the mesenteric, that means the muscle level interstitial cell of Kajal. Also there is the septal interstitial cells of Kajal, also present in deep muscular layers, and also present in the luminal wall. So the GIST may develop from any of the layer of this interstitial cells of the Kajal. So what is the origin of the GIST? The GIST is originated from the interstitial cells of the Kajals. On the other hand, here we can see the Brunner's gland. Brunner's gland is specific for the duodenum. The Brunner's gland only present in the duodenum. Then primitive stem cell of the gut wall, it is also not true, because the primitive stem cell of the gut wall, they giving rise to the other cells of the gastrointestinal tract. Also the fundic gland, this fundic gland is responsible for different type of the secretion, but not the development of the GIST. And antral goblet cell also not responsible for this. So interstitial cell of the Kajal, from here the GIST usually develop.